Okay, that's right. Now I know a lot of people that listen to this podcast have had some kind of weight loss surgery.
Yeah.
Um, so if we look at, say, the bypass and the sleeve, how does that affect that normal stomach that you're holding in your hand? After a bypass, for example, we don't have that size of stomach anymore. How big is our stomach after that?
So when we do a bypass, we cut off just a little part of the stomach to use for food. So the bit above my fingers, the gullet empties into this tiny little pouch of stomach here.
Yeah.
And then what we do is we leave the rest of the stomach inside. So nothing is removed when we make a bypass.
Mm.
But what we do is we make the stomach a lot smaller, leave this, and then we bring up some intestine from here and plug that into here. So
Okay.
essentially the food short circuits.
Yeah.
It goes down into the small intestine, bypassing the stomach.
Yeah. So for those people, again, that are on audio, just so you know, whereas the size of the stomach before was the size of Shaw's hand, we're now looking at a stomach that is probably the size of one finger. That's
Yeah,
the
about the
big
size of an
difference.
egg.
About the size of an egg. Oh, I see. Yeah.
Yeah.
Okay. Yeah.
So
The length
that's
of a
about the
finger.
size of a grapefruit.
Yeah.
It'll be about the size of an egg.
Oh, that's a good way to look at it.
An empty stomach is the size of a
Yeah.
grapefruit.
Yeah.
The full stomach will probably be the size of a yellow melon, maybe a bit bigger.
Wow.
Yeah.
Gosh.
So it can accommodate a lot of volume. It just relaxes and accommodates the food and then starts to contract and mush it all together with acid. And your stomach produces about 2 liters of acid a day.
Right.
And if you're scientifically minded, the pH is around 2, which is pretty damn acid, pretty damn strong acid, strong as vinegar at least.
Right.
And that will help physically break down the food.
Okay, so when you've had a bypass, we saw earlier how the stomach will extend into the left side. If you fill up the egg-sized piece of your stomach, what happens to that?
That will expand to an extent, but then it will just start to empty down through the new join straight into your intestine.
So it will force the food in and give you more pain, basically.
Well, it will be uncomfortable, yes. Yeah. It should give you a satiety signal, a strong satiety signal, because putting undigested food into your small intestine makes it send out a signal saying, hang on a minute, this is going too quick, slow down, stop eating. So that's part of the response of food in the small intestine, is to secrete GLP-1. Mm-hmm. Heard of that one before?
Once or twice.
So your intestines start to secrete GLP-1 when food goes through them. And if you put raw food into the small intestine, you get a strong GLP-1 signal. And that's the basis upon which the companies developed GLP-1 drugs.
Right. Yeah.
Because they thought, if we can mimic this signal, will it help lose weight?
Yeah.
Yeah, it does.
Of course. And it will make you a lot of money.
That's the bypass. Yes.
Yeah.
Well, yeah, they've spent billions developing the stuff.
Okay. Fair enough.
So they have to recoup their costs, otherwise they're never going to bother.
Yeah.
But unfortunately, regulatory processes have got in the way, and they've made it so expensive to develop drugs that it's almost counterproductive.
Yeah, which is a shame. And so now, if we're looking at a sleeved stomach, how different is that?
So a sleeve turns a stomach from a grapefruit size into a banana size stomach. So basically, this bit below my fingers gets cut away and thrown away.
Okay, so
we
it's
literally
actually
throw
removed.
it in the bin.
Right.
We actually remove it, and all that's left is the bit that goes from the esophagus down along what we call the lesser curve, the stomach, and then into the intestine. So all of this bit here underneath my fingers goes away.
Okay, so it's banana shape rather than banana size.
It's banana shaped and banana sized, actually. It's a pretty good. One of the early developers of the technique used to call it banana stomach.
Oh, okay.
Because that's what you get left with, a banana shaped, banana sized stomach.
Right. Okay.
And So that removes this part of the stomach. So the floppy, expandable bit of the stomach that expands towards the left side is gone. Now that has two effects. One, physically, you can't fit a lot in there, because you can fill a grapefruit-sized stomach with quite a bit before it really starts to expand. A banana-shaped stomach is, you don't need to put much in there and it's full.
Yeah.
But also the stretch receptors of the stomach, which tell you when you've eaten too much, are gone. But also the ghrelin hormone cells are gone.
So they are in the part of the stomach that you have cut away and disposed of.
Yeah.
Right.
So in that respect, your ghrelin levels will change such that you don't feel so hungry. Your stretch receptors, for reasons we don't understand, because they're not active anymore, or less active, and you get less of a signal, it confuses them so that actually a small amount of food means that you feel full.